Hello and welcome to The Business, and today I'm joined by Tony Banerjee. He's our resident doctor. Tony, give us a few quick tips on what to look for with drugs in the workplace.
There's lots of different drugs. There's obviously the prescribed medication, there's non-prescribed medication, there's illegal drugs, and then there's the kind of legal things that you and I all do. We kind of have like a drink of alcohol, but there's some people for whom that becomes a problem. So I think there's various things to look at there. I mean, one of the things that I always recommend people look out for is kind of erratic behaviour, really. I think it's not always as easy as this person's hungover or looks hungover, so they must have been drinking the night before. For instance, some people, it's been ongoing for so long that they've had a drug problem that it's just become normal. So when they come for the interview with you, they may have just been at that level. I think that if it becomes a problem, I think that, of course, action needs to be taken. I don't think there's any like pro forma of signs that you can look for. I think basically erratic behaviour, any suspicion, I don't know, if somebody drops their handbag contents and you see something that shouldn't be in there, that's also would alert you. But I think that the main thing is just to have a reasonable index of suspicion. And if you find anything, be very prompt about action.
All right, Tony, so if I suspect anybody then of taking any drugs, what's the next step that I could take then?
Okay, well, we can organise urine and blood kind of toxicology screens, really. So you're looking for various drugs in the bloodstream or in the urine which can be excreted. And I think that, again, you would have to make it clear before the person came for an interview that the drugs in the workplace will not be tolerated, because I think a lot of places don't have that rule. So once somebody comes in, then again you've got the whole thing about discrimination again. One of the things that we deal with in my NHS work, we're a big East Hall practice, and we do have quite a few people who are on methadone, who are ex-heroin users or even current heroin users. And one of my prerequisites for anybody to join the methadone program that I run is that they have to have a clean kind of drug screen at the onset, and then they have to have regular clear drug tests during the course of the methadone. So
they've got, but they've already done it then. I thought that methadone was just like, well, we'll give you this and it'll get you off that, and then we've weaned you off onto a weaker drug. I thought that's how it worked.
Methadone is basically a kind of substitute which you're trying to wean somebody off. So let's say, for instance, if you're injecting heroin every day, you've come to me as you've recognised the fact that you want to come off the drug. My next step is then to kind of clarify exactly how we're going to do that. If the person's got the willpower to do it, and then put into place the kind of wheels to kind of stabilise that person. So, for instance, it might be that they benefit from a combination of drugs counselling, or maybe that they benefit from just a methadone program, or some people just don't have any motivation, and that a lot of it's just a social thing which they will do regardless. Sometimes you can't identify that until you've got them onto the program. However, by regular drug testing, you can check whether somebody's still taking drugs over and above what you prescribe.